Incivility, we have all observed it. Many of us have experienced it personally, professionally, or both. Uncivil behaviors can be verbal or nonverbal, intentional or unintentional, all which convey a lack of respect to others, oneself, the situation or environment we are in, and a lack of professional integrity. Uncivil student behavior is increasing in academic settings, including nursing programs. Faculty who ignore or give cursory attention to uncivil student behavior can perpetuate the continuance of these behaviors into the workplace after graduation. Uncivil student behaviors are on a continuum and often occur from stress. Most are low level or slightly disruptive to others and the teaching learning process. Examples are personal conversations during class, eye rolling, misusing technology in class, sleeping, dominating discussions, and similar behaviors. Higher levels of uncivil student behaviors have been reported, such as aggressively challenging faculty during class, verbal outbursts, and student behaviors that threaten the safety of faculty or others. This conceptual model illustrates a way to empower students. In addition to observing professional and civil role modeling by faculty, assisting students in being motivated, maintaining psychological comfort, developing problem-solving skills, and assuming responsibility for self-direction results in constructive, reciprocal, and engaging professional relationships. Let's briefly look at each one of these concepts. Motivation occurs when students realize there is an incentive or reward to be achieved. Students are then more likely to want to achieve this goal. Psychological comfort occurs when feeling safe, such as controlling self-destructive impulses and avoiding harmful situations. Having the ability to successfully and amicably problem-solve clinical and classroom conflicts rebalances the environment to professional and civil interactions. Self-direction is self-directed learning. Nursing faculty can empower students in self-directed learning by providing case studies, simulations, and vignettes such as this one. Take a moment and reflect on a time when you observed or experienced incivility. What was the motive of the person exhibiting uncivil behaviors? How did this uncivil interaction make you feel? How could this interaction have been addressed in a civil manner? After viewing and reflecting on this vignette, you will be able to recognize the range and type of student behaviors associated with incivility, explain why student incivility occurs, identify faculty interactions that promote awareness and growth of professionalism and civility in nursing students. Let's observe Professor Wright and her students in clinical post-conference.
Thank you, Rachel, for sharing your patient's information with us today. Anne, can you go ahead and tell us a little bit about your patient that you had? Anne?
What?
Can you go ahead and tell us a little bit about your patient that you work with today during clinical? Your patient is similar to Rachel's patient.
My patient?
Yes.
Which one? I didn't hear Rachel.
Anne, are you using your iPad during our clinical post-conference to take notes on what we're discussing?
No.
Well, can you please close your iPad? Thank you. Now, can you please tell the group about your patient that you took care of today?
Miss Roberts is a 74-year-old female, a patient of Dr. Ibis who was admitted 2 days ago.
Thank you, students, for attending post-conference today. I will see you all later. Anne, can I please have a moment to talk with you?
Yes.
Anne, I'm glad we had a chance to talk today. I'm aware that you were using your iPad during our clinical post-conference, but you were using them for something other than our discussion that we were having. Is that correct?
Yes.
Well, can you help me understand why you felt that it was necessary for you to use your iPad during our post-conference?
Well, I was trying to get something done that I needed to do. It's hard to manage all of this workload with the time that we have. It's stressful.
Well, I understand that you're under stress, and then I also understand that multitasking is now the norm. But if you remember, or you can recall back from our first clinical day when we talked about during orientation about professional behavior, whether that's nonverbal or verbal professional behavior. Using your iPad during our clinical post-conference can be seen as uncivil behavior, nonverbal uncivil behavior.
Yes, ma'am.
So how do you think this may affect your peers or those that are around you?
Well, I hadn't really thought about it that way. It might not look like I'm paying attention or that I'm not interested in what they have to say when I use my iPad, but that's not what's going on. We all take notes, and it might not look like I'm a team player, but I am. And this is a close group. They know me.
Well, I understand that you all are a close group. However, the behavior can be seen as uncivil behavior. It implies that there is a lack of awareness about yourself and also the environment that you're in. It can be looked at as unprofessional behavior. How could this affect those that you're working with?
Others could miss learning opportunities because I'm not sharing my knowledge and my experiences.
That's a good thought. Do you have any other ideas?
Well, my not paying attention might show that we're not all learning towards a common goal. I guess that could affect morale, and there might be a feeling that we're not all learning at the same pace.
How also could this affect your future in nursing and how others perceive you in nursing?
I could lose out on reflection and possibly knowledge in my nursing practice by not listening to other people's experiences.
So how can we promote a culture of civility within the profession?
Well, I've been thinking about going to student services to try to learn some better time management skills. And using today's example, I won't use my iPad or any other technology during post-conference. And I'm going to be aware of the situation and the environment, and I'm going to make a conscious choice to promote principles of civility. I always want to be seen as professional and exhibit civil behaviors.
Well, thank you, Anne, for sharing that insight. This really does speak to the professional aspect of nursing. You're learning how to role model civility in your environment, and this will help you in your future career. So I really appreciate you taking time out to talk with me today.
Thank you. I'm going to be more aware of myself and the environment, and I'm going to continually reinforce professionalism and civility. And I'm going to also be mindful of those around me and what civil and uncivil behaviors that they're displaying so I can learn vicariously as well.
Pause the video and reflect on Professor Wright's conversation with Anne. How was Anne remotivated to represent herself in a civil and professional manner? What did Anne discuss to rebalance psychological comfort in herself? How did Anne problem solve today's behavior to prevent a recurrence in the future? What self-directed learning did Anne propose to continue awareness of professional civility? Student incivility in nursing programs is increasing and has been for decades. Most uncivil behaviors are rooted in stress, occurring from academic workloads, balancing time among work, school, studying, friends and family, financial concerns, lack of sleep, and similar events. The resulting uncivil acts that occur from stress can decrease self-esteem, prevent effective teamwork, decrease morale, and potentially lead to higher-level uncivil behaviors. Nursing faculty have a responsibility and opportunity to recognize and quickly address student uncivil behavior. Permitting students to continue uncivil behaviors by allowing a permissive environment will ultimately transcend into the workplace after graduation. Addressing student uncivil behaviors as soon as possible after they occur reflects best faculty practice. We hope this topic has piqued your interest and effectiveness in advocating professionalism and civility in the nursing students you encounter. Not only can you have a positive influence on individual students, but your impact in creating and maintaining civility will also extend to the nursing profession and workplace.